I am going to be talking about a COPD treatment plan. Hello, Mr. Smith. My name is Melissa from Respiratory. I hear you are going to be discharged from the hospital tomorrow. We are going to go over your COPD treatment plan for home. Please let me know if you have any questions while we are going over the information. We want you to stay well and out of the hospital. We want you to be able to manage your symptoms at home. The first thing we are going to talk about is your medications. The first one is called Increase, which is this green and white one right here. This is not a medicine that you will take if you're short of breath. It is called a maintenance med. You will take this medicine every single day, whether you are sick or not. So to start, you're going to slide this green cover over. You're going to see the counter on here, and every time you slide the green cover over, it'll count down starting with 30 and it'll go to 0. When it's at 0, you will get a new one. So what you're going to do is you're going to take in a breath, keep this away from your mouth. You're going to blow all your air out, put your mouth on the mouthpiece. You're going to suck in a breath. You're going to try to hold your breath for 10 seconds without blocking the vent. Take this out of your mouth and you're going to blow out. And you will take it once a day, like I said, every single day. This medicine will help maintain your lungs and help keep them open so you can get more air in and out. The next medicine we're going to talk about is called Brio. Brio also will help keep and open your lungs, and it also has a steroid to help with any swelling in your lungs. You're going to take it the same way as Increase, and you'll take it once a day, and you also will not take it if you are short of breath. The most important thing with Brio is when you're done, because of the steroids, you're going to rinse your mouth. People who don't rinse their mouth can develop thrush, which is yeast of the mouth. The next med you are going to be sent home with is called Ventolin or albuterol inhaler. This is a medicine that you will be ordered as needed, 2 puffs every 4 hours. You will only take this medicine if you feel short of breath. The important part is to not take this medicine more than you're prescribed. If you're taking it more than you're prescribed, that's when it's time to call your doctor and say that there's something going on. So to take this medicine, you're going to need a spacer, which we're going to give you one just like this. You're going to insert the inhaler into the spacer. You're going to shake it up, put your mouth on the mouthpiece here. You're going to suck in a breath real steady. You're going to hold your breath for about 10 seconds, pop this out of your mouth, and you're going to blow out. If you need to take a second puff, there's 2 puffs ordered every 4 hours. You'll wait a minute and then you'll take your second puff the same exact way. Now this medicine will help with shortness of breath. Some other meds that you will be sent home with are steroids and antibiotics, which the nurse will go over the dosing and how you're supposed to take them when you're discharged on your discharge paperwork. The next thing we're going to talk about is oxygen. You're going to be sent home on 2 liters at rest and 4 liters with activity, meaning whenever you're getting up and doing stuff. We'll send you home with a tank that looks like this. The whole Medcare will meet you at your house when you get home, and they'll bring you what's called a concentrator that kind of looks like this. So they'll give you enough tubing so you can walk around your house, and they'll also give you little tanks or a little concentrator just like this if you want to go out. Say you want to go shopping or go out to eat. The oxygen will help with your shortness of breath. It'll help from keeping your blood oxygen too low. Some of the important things to know about home oxygen is you don't want to smoke around it and you don't want to be near an open flame. And when you take the tanks in public or anywhere around your house, if you're not using your concentrator, you want to make sure they're very secure. The next thing we're going to talk about is smoking cessation. I see here that you have a 50-year pack history. Are you willing to think about stopping smoking? There are a lot of things available if you decide that that's what you would like to do. We have gum. There's patches that you can use. There is sprays that you can spray under your tongue. There's lozenges that you can use. And there's also medicine called Chantix that you can use. Other people also, there's hypnosis that they use, and they also go to support groups when they're trying to quit. If you're interested in this, it would be good for your lungs. The sooner you quit, the better. You can just let us know if you're interested, and we can help get you set up with everything. One of the benefits of quitting smoking is you can add 2 years to your life even at your age. You're 69. Anybody over 65 who quits now can add 2 more years to their life. Some of the facts about quitting are 20 minutes after you quit, your heart rate and blood pressure will drop. 12 hours after you quit, your carbon monoxide level in your bloodstream will actually be normal. 2 weeks to 3 months, your circulation, your lung function will improve. Your risk for a heart attack will begin to drop. So those are some of the important things. Plus, you need to think about all this money that you would be saving if you quit. I've had patients that quit and they actually save all the money they spent on smoking, and they take vacations. Something else that the doctor has prescribed is they have consulted you for pulmonary rehab. Pulmonary rehab can help you exercise, and there's also an education component involved where you can learn stuff about diet, exercise, your energy levels, and so forth. And how pulmonary rehab works is you will go to the pulmonary rehab gym here at the hospital. You will exercise for 20 minutes to an hour 3 times a week, and you'll be with other people that have, the same type of disease that you have, or maybe something else, and you'll get to, make friends and learn how to exercise all at the same time. This is what our pulmonary rehab looks like. You can see we have all different machines that you would use. And it's a very successful program. It really helps people improve their energy, their shortness of breath, and even help them do things they couldn't do before. The next thing we're going to talk about is vaccines. I see that you didn't get your flu vaccine or your pneumonia vaccine this year. Getting these vaccines will help you prevent some of the infections like the influenza and other viruses and bacteria that will cause your exacerbations. Having these vaccines will maybe decrease you from getting sick and, help you from staying out of the hospital. So let me know if you would like to take them before you leave, and we can have the nurse give them to you. One of the important things about going home is about recognizing when you're having an exacerbation, what to look for, when to call the doctor. Like I said, most exacerbations are actually caused by an infection, and they require steroids, antibiotics, nebulizer treatments, and so forth. Some of the things that you want to look for at home is if you feel like you're more short of breath than normal, if you have increased or new mucus production that you didn't have before, if you start to have a cough that you didn't have before, if you feel like you're wheezing, which is not normal for you. Those are some of the important things that you want to look for. And as soon as you start to have these symptoms, you should contact your doctor, so that we can try to keep you out of the hospital. And anytime you're having symptoms or something's going on that you feel like it's not right, just call into your doctor on your discharge paperwork. The nurse will give you the numbers for that. One of the other things that they'll talk to you about in pulmonary rehab, and you can even talk to your doctor about, is diet. They have found in studies that there have been significant improvements with patients of COPD that go on a high-fat, low-carb diet, which is eating a bunch of fruits and vegetables and meats, omega-3s like fish and so forth. Here's a good picture of different things. We can even have you meet with a dietitian. So if this is something you're interested in, please let me know. And when you go home, I know you have your wife and your family. There are support groups available here at the hospital. If you'd like to enroll in them, let us know. And also, pulmonary rehab will be a good support system for you. Having a support system will help you stay well. If you have any questions, please let me know. I hope that you feel better. And I hope that we don't see you again here in the hospital because you're doing well. Thank you.